No, we're good. Okay. Hey guys, welcome back to my channel. We're looking at a really important topic today. There's a couple of guests who we have on with us today, so let's get into it. For Aboriginal people, good health is viewed as a holistic concept, including social, physical, emotional, spiritual, and cultural well-being for the individual and the community. Poor mental health can have detrimental effects on an individual's ability to experience fulfilling and productive lives. Psychological distress involves an individual's psychological pain, such as depression and anxiety. Today, we're bringing to light the impact that depression has had and is having on our Aboriginal youth. We'll also outline a few exciting programs that aim to not only address the prevalence of depression and mental health issues, but also give our young people a way to safely and healthily negotiate the world of mental health. Australia's Aboriginal youth account for 5% of the population of 10 to 24-year-old age bracket. With such a large and special population, we must be aware of the health needs, especially in relation to mental health. For instance, according to Australian Institute of Health and Welfare, of 67% of Indigenous youth in Australia aged 15 to 24 experience low to moderate levels of psychological distress, while 33% experience high levels to very high levels. It's also been revealed that these youth are exposed to these risks at a far greater rate than youth of other cultural backgrounds. Greater exposure inevitably leads to considerable increase in depression statistics amongst our Aboriginal youth. Approximately 2/3 of Indigenous youth experience one or more personal stresses, most common being unemployment, and 1 in 3 experiencing racism. These stresses can ultimately lead to poor mental health and depression. Psychological distress can be linked with suicide rates. The leading contributors to disease burden in Indigenous young people aged 10 to 24 was suicide and self-inflicted injuries. The prevalence of COVID-19 has had a drastic effect on population, of all population health, mental health issues. However, this is shown to be exacerbated within the Aboriginal community. The youth group has been impacted largely by school routine disruption and disconnection with peers.
In response to health needs and reasons behind it, Aboriginals face negative experiences when accessing healthcare. Firstly, Aboriginal youth may experience cultural barriers in the health professionals, can face obstacles when delivering health services to ethnic communities. Given that language is a major component of culture, Aboriginal youth are heavily affected as language is crucial to their cultural practices. Due to the fact that Aboriginals only account for just 2.8% of the Australian population, this low percentage in comparison to the rest of the population comes to light that Aboriginals may be exposed to the underlying barrier of miscommunication, as Indigenous people speak more than 100 dialects. Due to the barrier between language can affect communication. Therefore, these differences can lead to possible outcomes of misdiagnoses and inappropriate delivery of health, resulting in unsatisfactory health outcomes. Discrimination is one major contributing issues for Aboriginals when accessing healthcare. This is evident as a result of the historical events impacting on the stolen generation and beliefs of a white dominant society, arising the tension between Indigenous and non-Indigenous people in healthcare settings. In 2020, 22% of the Indigenous Australians reported being racially discriminated against by doctors, nurses, and medical staff in the last 12 months. This demonstrates a great deal of health service providers are not being culturally appropriate and instead being discriminatory towards clients of Aboriginal background. This continual discrimination during healthcare can lead to a negative perception of self that can adversely affect their health and well-being. Furthermore, influences of the experience may above lead to stigma towards healthcare. In response to the historical impacts of the stolen generation, Aboriginal youth may have been raised to mistrust and utilize traditional health practices rather than attending to Western healthcare alternatives. However, health professionals need to facilitate these negative experiences by acting in accordance with cultural competency to reduce health inequalities when dealing with Aboriginal youth.
Chinese migrant youth face similar situations with Aboriginal group when they access to healthcare services. They are not familiar with health system and always experience fragmented healthcare due to language, culture, and attitude barriers. Around 32% Chinese migrant cannot speak fluent English or cannot speak English at all. It impacts their abilities to interact, engage with healthcare providers, and navigate in health system. Chinese migrant patients also experience less culturally competent services. They feel frustration when the healthcare providers do not respect or cannot clearly address their questions about traditional Chinese medicine. And they also culturally feel shameful when they seeking mental support. Despite the similarities, Aboriginal and Chinese migrant youth have different experience and challenges. Aboriginal youth have more difficulties in access to proper health services compared to Chinese migrants. They usually live in remote areas with less supportive infrastructure, such as transport, number of clinics, and professional health workers. They generally have a negative experience of the crowded waiting room where people know each other. Education level is positively associated with the health literacy and experience of care coordination. We can see from the chart here, compared to the Chinese migrant, around 60% have a higher non-school qualification. Aboriginal group only have about 11%. It leads to the lower level of health literacy and poor experience of care coordination. Lastly, different cultural factors impact their behaviors. For example, Chinese culture have high regard for the authority and they try to be good patient by agreeing everything health providers say, even they doubts. It's important to encourage them to ask questions and share feedback to increase their engagement and achieve better health outcome.
Symptoms of depression in young people can have effects on their emotions, feelings, and behaviors, causing difficulties with participating in daily occupations and impacting their overall well-being. Occupational therapists like myself engage with young people through meaningful activities to encourage participation in what they need and want to do to promote health and overall well-being. Occupational therapists can help address depression in Aboriginal youth by offering interventions, guidance, and support to youth and their family. Interventions can involve promotion by educating youth of the value of participating in enjoyable activities to improve mood.
Often, depression can be partially treated through physical activity. As sport and exercise scientists will be able to use their knowledge and expertise in sport or physical activities that will beneficially combat the effects of depression. Sport and exercise scientists could work with young people to develop a sports program. Such a program or activity will focus on teamwork, self-achievement, and a sense of self-worth. These things are incredibly beneficial to battling depression in Aboriginal youth in order to close the gap.
So, conducting an exercise program will aim to strengthen the unity of youth and their protective factors within their culture, such as identity, cultural pride, and necessary life skills. Developing inclusion of populations from the same community opens opportunities to participate in a cultural environment. This can influence connectiveness in relation to populations that practice similar cultural traditions. These factors can increase the aspects of culture and assistance in the recovery of any distresses and experiences of trauma.
For TCM practitioners like me, we treat human body from holistic view that links to nature, emotions, color food, and vice versa. Regarding depression, TCM supports clients with a broad and diversified medical practices, including herbal medicine, acupuncture, cupping, gua sha, dietary therapy, and exercises. Despite the technical skills, other soft skills like effective communication, cultural competency, risk management, and coordination skills are also required. Specifically, TCM Board of Australian Code of Conduct highlights the extra responsibilities needed for the child and young people care, including reporting the abuse and neglect situations.
In order to help with depression among Aboriginal youth, our team has worked on a tailored school program called Youth Rise Up. Youth Rise Up will run once a week for 4 weeks. The first 3 weeks will be a 2-hour after-school program, and week 4 will be a full-day program from 9 to 3. The pilot of our program will target rural areas with a high population of Aboriginal youth. It will be held at schools in the area that have agreed to be involved, alternating between each school every week, transporting students via school buses. We really want our program to have effective outcomes, so we plan to present our program to Aboriginal leaders and teachers in the targeted community. The aim is to seek their input and involvement in any adaptation, changes, and further development of the program. In engaging with Aboriginal leaders and teachers, we will encourage them to promote this program in the community in ways that will reach our targeted demographic. We will also promote within the targeted schools via posters and through communications of teachers. For our program to be successful, we need to adapt it as it progresses. We aim to regularly evaluate our program after every week to reflect on strengths and weaknesses of the program and make changes where needed.
So week 1 will consist of a round-robin competition of touch football for Aboriginal youth and badminton for the Chinese migrant youth. Players will be put into teams with a fair range of abilities. We'll also focus on encouraging participants to really engage in physical activity. To encourage students to engage in physical activities, we will also invite sportspersons from the same background. Their involvement in the program will give these kids a sense of achievability and interactions with someone from their own culture, which will inspire and drive them to set higher goals.
In week 2, Chinese medicine program will have 3 parts, including matching nature and healthscape, emotion and health video sharing, and lifestyle and health to improve sleep. Sessions will be tailored to different population groups by using the resources from cultural background. Matching game will use Aboriginal paintings, and Chinese group will use Song Dynasty paintings. Videos and shorts will be used the resources from their own population group as well.
In week 3, the OT program will involve a variety of enjoyable activities to engage students to help improve mood. There will be 4 stations, a tie-dye craft, mindfulness colouring in, ball games, and a game of dodgeball. Aboriginal community members will be involved helping at the stations, encouraging students to participate. Towards the end of the program, I as the OT will explain the importance of engaging in enjoyable activities to help prevent depression and encourage students to join teams or clubs of leisure activities in the local area.
Week 4 consists of a full-day program with a mix of all 3 disciplines. It will be on a large school field with a variety of sports that will be facilitated by myself and Ryan, the sport and exercise team. Games and activities will be facilitated by Alana as the OT, and a follow-up showcase of Chinese medicine facilitated by Jiawei. Students can choose which activity they want to explore on that day. There will also be a short seminar at the end that will be run by Aboriginal leaders for education and health literacy purposes regarding depression and mental health. This seminar will briefly discuss the purpose of the program and encourage students to access our creative website for more information. We can gather at the end with each discipline and Aboriginal leaders to debrief on how the program will be adjusted and improved. We also mentioned that website, so the website will be accessible to anybody who would like to jump in. Now, we adjusted our program for Chinese migrant youth by location, so we're looking at a different demographic, so we changed by location. We also changed the sport that we're going to perform in our round robin. So we changed it to badminton instead of touch football. Thank you for listening, and we've got information about our website in the next slides.